These private flights keep coming to Omaha. The fourth transoceanic trip from Ebola-stricken West Africa ended for another healthcare worker on Epley's runway Sunday. 3 others have come before, each of them sickened by the dangerous Ebola virus. That's what's different this time.
There was some discussion inside the unit as to how they wanted to handle this case, simply because this patient hasn't been determined to have the Ebola virus.
The latest patient walked from an air ambulance to the transport that would take him or her to Nebraska Medicine, where officials say they are operating as if this patient already tested positive for Ebola.
He or she is here already. As we've learned, getting these patients the appropriate treatment as soon as possible makes a world of difference. So being able to receive a patient this quickly if they do have Ebola is extremely important.
Taylor Wilson, media spokesperson for the hospital, says Ebola tests began within minutes of the arrival, just after 2 Sunday afternoon. Test results could take 24 hours. The same medical team credited with healing 2 others is working on this latest possible case, all in the same hospital room at Nebraska Medicine's biocontainment unit. The observation lasts 21 days, even without symptoms. If the tests are positive, Wilson says now familiar Ebola treatments from hospital staff will begin immediately.
Our folks who work there are extremely well prepared to handle this patient, and they're just as prepared as they have been in the past.
Nebraska Medicine will not identify the patient or the organization he or she worked for without the patient's and the family's consent. It's been about 8 hours now since this patient arrived here at Nebraska Medicine, meaning it could be just a few more hours before we know if Nebraska will treat its 4th Ebola patient. Reporting live at the Med Center tonight, Kelly Bartnick, KMTV Action 3 News.